welcome back to Georgina Life. So something really exciting happened in Keswick. We have a new child care clinic, and it's nurse practitioner-led, which is great.
Love that.
We have Beth Cowper-Fung. You are, well, you're the clinic director and a nurse practitioner.
Correct.
And this is so exciting. Thank you for being here to talk about this, because honestly, this is something that if I had little kids, I would be just jumping up and down about.
Yep.
So tell us a little bit more about it.
So we're really excited. We are the fourth of this type of clinic in the province.
Okay.
The first two were Couchiching and Markham Stouffville, which is now Oak Valley. And they started last year. And then Huronia Nurse Practitioner Clinic beat me by 2 weeks. And we are actually, we're operated by the Nurse Practitioner Clinic in Georgina.
Okay.
And we are in collaboration with Southlake Regional Health Centre's Pediatric Department. And we are coordinating it all through the Ontario Health Team. So I actually sit on the Joint Executive Steering Committee of the Northern York South Simcoe OHT, which used to be the Southlake OHT.
Because you don't have enough to do.
Yeah, so I do that, yeah.
So I always say, let's sit on another committee.
Right? Well, you can't complain if you don't get involved.
It's so true. And I mean, healthcare, regardless of whether we're talking a 1-year-old or an 80-year-old, is certainly a hot topic.
Yeah.
Well, that's really true.
Yeah. So we're really excited. We're going to take care of children that are 6 months old up into 18 years of age.
Okay.
And well, before their 19th birthday, we've decided. And so anyone in that age group, if they have an urgent, non-emergency healthcare need, they can sign up with the clinic online. We're still working through the online booking system. We have it at our main site, so we know it's going to come along. And once that occurs, you'll be able to log into the website. You'll see the options of all 4 clinics, whichever one is in your region.
Oh, love that.
We're all funded by Ontario Health. So there are no fees to the patients. There are no fees to the primary care provider. So if you have a physician who's in a payment enrollment model or a PEM, they sometimes get excited if you go to a walk-in clinic because they get charged for that fee.
Yes.
Right.
There's no fee to the physician, and there's no fee to the patient to come to this clinic.
Oh, that's amazing.
It is.
It's great.
It truly is. I mean, you can imagine being new to the country, you've got little ones. The last thing you want to think about is where am I going to get the money to?
Yeah.
True.
So I love the fact, and it's, I mean, I'm not a parent, but I just can't imagine that panic in the middle of the night. Like, what do I?
Yeah. So they'll be able to sign on and log in, which is great.
Yeah.
Once they do that, they'll put in their health card number, the age of the child, the birth date, and then that will automatically load right into our electronic medical record. So when you come into the clinic, the first person that you'll see is our registered practical nurse, and she will do a brief intake of why you're here today, have you had any medications for this, what was your temperature at home, questions like that. Weight, always very important with pediatrics to have a weight before you have a medication order. And then they'll move them into a treatment room, and then the nurse practitioner, whose name is Nikki, will come in and do the assessment, any diagnostic testing that's needed to be ordered or done on site, make the assessment and diagnosis and treatment plan. And then we plan to do a referral note back to the primary care provider so they know you were seen, which is something that doesn't happen in walk-in clinics right now, which will be helpful.
That is fantastic. Well, and you said, non-emergency.
Right.
And that's something that I think a lot of people don't understand.
Right, and that's right on our booking page, and it's also on the sheet that's on the door. So we've been open 3 weeks now, and so we've had some people walk in because we've still working through the booking process.
I was going to ask you about that.
And it's right on the door. If your child has trouble swallowing, if they've had a fever over 39, if they have abdominal pain that's not relieving, you need to be seen by the emergency department.
Yes.
We can't do ultrasounds or x-rays or blood work right on site.
Right.
So if you're that ill, please don't wait. We want you to go. And we also want you to call your primary care provider first, because they know you best.
Yes.
So if you can get in with your primary care provider, whether that's a nurse practitioner or a physician, that's where you should go. And if they can't, though, we're happy to see you. So you don't need a health card. It doesn't matter if you're attached to someone else. We will see anyone 6 months old before their 19th birthday.
So there's absolutely no reason why any individual cannot get health care.
In that age group. Right
Yes.
now we're seeing that age
In
group.
that age
yes.
group, yes. Sorry. I
Now,
didn't-
we have hired a primary care nurse practitioner for that site, rather than just a not just, because there's 300 of them in the province and they're magical. But we did hire primary care so that if they come in and the mom has the same symptoms,
Oh, yes.
and rather than sending her or him, if mom or dad comes,
Yeah.
to a different walk-in, we have the capacity to be able to see them as well if they need to be seen. But it's primarily for the child.
Yes.
That is
But it's still
fabulous.
sort of a one-stop shop if you need it to be, which is wonderful because there is that sense of panic. Oh, well, I'm the dad and I'm feeling this and my child is exhibiting the, like I'd be going, what the heck is going on here?
True. So how do people actually book again?
So the website that they can go to
Okay.
is care-clinics.ca, or Ontario Health has put together a really lovely poster
Yes.
that
Okay.
I sent over for you, and you can
Yeah.
click on the QR code.
That's fabulous. And the clinic itself is located in Keswick.
Yeah.
But for people out there that don't know, where exactly is it?
So it's 443 the Queensway,
Right.
which is in the same parking lot just across from Anchor Fitness.
Okay.
And there's a grocery store in there, Freshco.
Freshco,
So
right.
Freshco's in there. There's a Tim Hortons in there.
Yes.
It's actually probably walking distance to about 4 schools.
Right. So it's in the
So we'll be putting
Glenwoods.
posters up in the schools as well as posters in Sutton.
That's fantastic.
Mm-hmm.
I love that. And you know what? With the emergency departments now, I mean, gosh, you don't really want to be there if you don't need to be there.
No, and these were started, so last year during the cold flu season, we saw a huge number of what they call CTAS, which is the Canadian triage system,
Yes.
4s and 5s. So, CTAS 1, you're not breathing. You get
Right.
first. You go first. CTAS
Thank you for that.
Right? CTAS 2, life and limb. CTAS 3 is odd abdominal pains, needs more investigations. And then 4 and 5 are really kind of your walking wounded. And so
Right.
this was meant to be a CTAS 4 and 5 ED diversion program
Okay.
started by Ontario Health, which is the subsidiary to the Ministry of Health Ministry of Health and Long-Term Care.
Wow.
Shifted to rather than the LHINs, Ontario
Thank
Health.
you. I got to cut you up.
Wow.
Cutting people off. Listen, thank you
Gosh.
so much for all this information. And Georgina, don't go anywhere. We have so much more on today's Georgina Live. Stay with us.